Can you talk about the mentality of women? You were telling me that if you don't put enough fat in their butts, that they think you're a lazy surgeon or you're not doing a good job. And can you talk about the reason why you might not be putting all of this fat in somebody's body in the first place?
Right. So one thing that people have to understand about fat transfer is that you're actually taking the fat completely out of the body and you're putting it back in. And that means you've disconnected the fat from the native blood supply. Okay, and so when the butt receives the fat, or whatever area receives the fat, it now needs to revascularize that fat. So what does that mean? That means that the two highways need to connect. Within the fat, there's a little microscopic highway of blood vessels still, and the rest of the body now needs to reconnect to it. And that's why we say don't sit for 2 weeks, or don't go to Vegas and run around within the first 2 weeks. Take it easy. Let the fat revascularize, meaning let it become reconnected to the body.
There's two things that I'm worried about when we're talking about this tourism with surgery coaches. Number one, Chris, I highly doubt you had a true informed consent process. I'm willing to bet you did not know the potential risks. And what I will say is if a patient knows all the risks and they are informed and they give an informed consent, then they are shouldering some of that burden. They know there's risks. But the second element, and I'm sure you have this, Dr. Patel, is there's got to be someone you can contact the minute a problem arises, the minute there's an issue. And my biggest concern hearing your story, Chris, and certainly nor the story of your aunt, is there was nowhere to turn. If these are this risky and you're going to unaccredited facilities, there's no informed consent and there's nowhere to turn when things go bad, that's what's really scary to me. Dr. Patel, before we let you go, what is the one word of advice you would give to someone who's considering, Dr. Ordon has expressed obviously his concerns, but what is the one word of advice you would give to someone considering a Brazilian butt lift?
Start with a board-certified plastic surgeon. We go through a very, very rigorous process to become board-certified plastic surgeons. And when you look at board-certified plastic surgeons, at least you know that their work is real. A board-certified plastic surgeon is not gonna put up fake work or somebody else's work.
That's what worries me, is if this ideal image that these surgery recruiters are putting out there, and I know, quite frankly, they're using, Leslie told me they're using some of your before and afters to promote their practices. To me, this becomes really scary.
I've had them stolen in 7 or 8 different countries already. I've contacted their boards of those nations and they haven't done anything about them. And again, like you said earlier, I think it's important to say that there's amazing doctors all over the world.
Oh, absolutely.
Plastic surgery was created by doctors in Italy, in Great Britain, in Brazil, in Mexico. All of our forefathers were all over the world. And so we're not saying that you can't have an amazing doctor in another country, but here at least you can know what you're getting when you go to a board-certified plastic surgeon. And if you know that they have a lot of nice pictures and good before and afters, and you can meet people that have had surgery with them, and you meet with them in a consultation and you get a good feeling about their staff, that's when you know that you can go. You don't need a recruiter, you don't need a consultant or somebody to get you a doctor. You need to call their office, talk to their staff, set up a consultation, and meet the doctor. Yep. And that's who should perform your surgery.
If I can button it up, my tips, it's all about safety first. Chris, I'm gonna use you as an example. Yes, price is a concern. Yes, you wanna see results, but your safety, your life come first. Make sure that those things are the priority whenever you're having anything done.